myself and Stuart are going to do a bit of a double act and really share with you what we think is important in terms of delivering outstanding children's services. Many of you will have your own stories, you'll come from good and outstanding counties, and you'll have your own view on what makes you outstanding or good, and really we just wanted to take the opportunity to share the sort of things that we think are important and tell you about our journey in terms of improvement. So I've been in Lincolnshire since 2006, and in 2006 we had a joint area review, the JAR, the sort of forerunner to the Ofsted inspections now. And I think it's fair to say that they gave us, put a mirror up in front of us, and we were barely adequate at that time. And it was a really good wake-up call for us in Lincolnshire to decide what we wanted to do to actually improve things for children and young people in our county. And if I was to sum up in one word what I think makes a difference, it's about leadership. Leadership is what changes your children's services. And that's both from a political leadership perspective, but also from an officer leadership perspective. So back in 2006, had a real sort of tough look at ourselves and decided that we needed to get the right people, went through a significant recruitment to get the right people on the right bus, all going in the one direction. We set out a real clear vision about what we wanted to achieve and had a plan to achieve it. Because only to have a vision without a plan, you won't achieve anything at all. So we're going to share what the key ingredients is we think are important in terms of leadership.
Thanks, Debbie. We will swap about a bit here. So really what we're trying to do is give you some insights, and this is an expression that my own chief executive, who's at the back there, used about seeing that his job was to stop me going down my rabbit hole. And actually that's really true. You don't want to be down your rabbit hole of children's services. It's really easy to go down there. It's lovely, warm, comforting. It's a nice place to be. But actually, if you're isolated, if you're not part of something else, if you're not getting scrutiny and accountability, it is not a good place to be. So you need to avoid it. So there's some of the things we're going to show you around it. That's for you.
Okay, so the LGA produced a guide of chief execs, what they needed to know around children's services. And the other important document is the DFE document on the role of the lead member and of the DCS. And so I want to highlight three important issues just really to go through. So the first thing is the importance of the relationship between what we call the quartet. So the chief executive, the director of children's services, the lead member and the leader of the council. Those four individuals are the individuals that will drive forward safeguarding practices in any local authority area. And the benefit of them having a really open and trusting and honest relationship can be absolutely inspirational. I've been very fortunate in my career to work with some really inspirational political leaders. And I think the importance that they've given to me is confidence. Safeguarding is really difficult. Things happen all the time in terms of safeguarding. But unless it's systemic failure, which is the DCS's responsibility, the lead member and the leader have absolutely given me their strong political support and trust and confidence. And it's that enables you to be a really confident local authority. Equally, you need a DCS who actually wants to contribute and not go down into the rabbit hole that Stuart's spoken about. A Director of Children's Services who declares UDI or does a lot of shroud waving isn't building that honest and open collective relationship that needs to thrive for inspirational practice. The second thing that I would say is that you need a children's services that love the corporate centre, and you need a corporate centre that love children's services. Unless your finances understand children's services, unless your human resources department are working absolutely determined to support the recruitment and retention of social workers, unless your legal department is absolutely working hand in glove with your social workers, children's services can't thrive. And also, if Children's Services declare UDI and set up their own systems within their own service area, they won't thrive neither. So it has to be a two-way relationship. And I think then the last thing is clearly the leader, the chief executive and the lead member can't get into the details of performance reporting. There must be a delegated responsibility. And Stuart's going to talk in a minute around some of the bits of performance that you do perhaps want to understand. But the signs of deteriorating performance in children's services can be opaque. It is difficult to spot. But the one thing around children's services safeguarding is a bit like a ball of string. The minute things go, it unravels very, very, very quickly, which is why you need really tight management oversight and grip.
So, I'm going to give you some oversight of some of what I think are some of the basic conditions and things you need to know about children's services. I always worry about doing these things to this sort of crowd, that next time I see my colleagues, which will be in Bournemouth in a few days, they're going to roll their eyes at me and say, what on earth have you been saying to our chief executives and lead members? Which one or two have done when I've done this previously, so this gets me into trouble. It's rare that I like to say Ofsted are right about something, but this is probably, for me, the most important slide you're going to see today. And if you take nothing else away from today, it's the first two of these questions. So this is from the Ofsted framework, and they give us three really helpful questions. And the first two are really important and ask you to think about your own children's services. What do you know about the quality and impact of social work practice with children and families in your authority? And then the second question, how do you know it? Really important questions that Ofsted are going to come and ask about your services. They've got far more sophisticated over the years. I used to be a huge critic of Ofsted when they used to come in, look at an electronic system and judge you on it. It drove a whole thing about if it's not recorded, it hasn't happened. It didn't give you a depth of the actual practice that was happening within children's social work, and it was the wrong thing to do. They don't do that anymore. They don't have focus groups. You cannot blind them with strategy and visions and documents. They come and talk to your staff, and it's the right thing to do. They will sit with frontline social workers. So what do you know about the quality of practice? How do you know it? Are really important. There are some really basic conditions for success. And again, these are not really about strategy, not really about plans. Everyone will have service plans and strategies and visions and all these things coming out of our ears. We're all good at that kind of thing. These are some of the basic conditions of success. On any improvement journey, the first thing you need to do is get the basic conditions right. If you don't have them right, great social work cannot flourish in your authority. This is my version of it. There are other versions of it. This was taken after discussion with Dave Hill in Essex, after some of the work he did. He's done a similar thing. But there's just some things here that I think are really, really important to get the basic conditions right. And I'll go through some of them quickly and talk to you a little bit more about some of the other ones. So the first thing is reasonable caseloads. Your social workers need reasonable caseloads. If they've got caseloads of over 40, they cannot do their job. If it doesn't work, if things go wrong and your workers have got caseloads of 40, that is not the social worker's fault, it's our fault. They cannot do their job without reasonable caseloads. There is no magic number, but we all know we measure averages. So the national average around England, I think, is between 17 and 18 cases. I like it to be under there, if we can get it there. If anything gets above 20, I'm immediately worried. I have that on a regular basis, and as part of that, I have the caseload of every single social worker. So I can look at the bottom, I can look at the top, and I can look at the average. Because the thing you have to remember in averages, it doesn't take into account your vacancies, sickness, people off. You need to know that. It's really important that people have reasonable caseloads. Stable workforce. You've got to work really hard for a stable workforce. We're really lucky now. I say lucky, it was a deliberate strategy in North Yorkshire. I don't have one single agency worker. Our recruitment and retention is high. We hold on to our staff. They like working for us because we have the conditions for social work right, and they enjoy working for us. If you've got a large agency workforce, they come and go really quickly. You train them, they've gone. You hold no organisational memory, no progress. It's hard to build a system of progression and quality when staff are leaving you constantly. You have to work really, really hard at having a stable workforce, recruitment and retention. Supervision and support, social workers want supporting. So you need to make sure that they're getting regular supervision, that they feel supported, that those things aren't always cancelled, that they are happening, that they're done to a high quality, that your staff who are supervising understand how to supervise. Sometimes your best practitioners don't make the best managers, and you have to transition and work them through that and train them and make them understand how they support other people and not just themselves. But you must have clear supervision and support for your workers. If they feel secure, they're more likely to stay with you, they're more likely to progress and do more themselves. A clear model of practice, I won't talk about that much here. I'm going to go into the slide on it a little bit later. This is really important towards the way that you do social work across your patch. Continual professional development. In the days of austerity, training budgets are often cut, but actually it's something we've invested more and more in. If I need my social workers to understand systemic practice, I need to train them in it. So you have to have training that matches your ambition of where you want to get to. So we do less and less of what I would say is traditional training, a day here, a day there, do this course, do that course. The link between doing training and bringing it back into practice is really strong. But you have to connect it to your practice to make that work. So we like to do our training and immediately have staff go and use it and check that they're using it and be rigorous around it. And the last one is you need to know yourself really well, really, really well. And again, I'll talk to you a little bit more about those. So we'll start with know yourself well. So this is how we know ourselves well. So this is a quality assurance framework that we use in North Yorkshire. It's not one we invented. It's taken from research in practice. Oh, look, and that's disconcerting. There's Des Holmes who's just walked in the door as if by magic when I mentioned research in practice and is your next speaker. And she's fabulous, so I'm a little bit intimidated about speaking before her. Do you want to just go out again, Des? No, you're all right. So this is from research in practice, Des's organisation. And in essence, this triangulates three things. And one of them we do really well, performance. So it's a basic requirement, isn't it, for any of our organisations that we have a performance framework and we understand the flow of work through our organisation. But on the whole, performance data doesn't tell you really anything about the quality of your services. It just tells you about how work is flowing. So a number of children looked after, a number of child protection plans, how many things were done on time, they're all process measures. So they'll tell you something about the flow of information, but they tell you nothing about the quality of practice. So you need to have a triangulation of then quality and user voice. What are people who use your services telling you about the quality of them and how useful they are and what difference it makes? And I'll give you some examples of the things we do in North Yorkshire. So this is my data table from the last one from user voice. And you can see there that we ask some very simple questions back to families that will fit with our practice model when you see that coming up. So the service provided, the support needed to help them make positive change. The family was involved in the planning, the family was listened to, and they were satisfied with our involvement. And you can see incredibly high success and satisfaction and involvement of our families. Way over 90% in all of them. Way over 90%. That tells me something really fundamental about the way our social work is received by the families we're working with. And again, that's really important in our practice model. So that's in a regular report. We get that, I get that on a quarterly basis. This is about the quality of practice. It's a bit of a chart. We're a science of safety user as an authority. In there we scale lots of things, 0 to 10, and we do lots of scaling with families by using best questions. But as part of our audit process, we use scaling questions to measure the quality of practice. Audit on its own is fine for audit purposes, but again, the way you audit, if you want it to drive practice, needs to be done in a particular way. But what this allows me to do is get a snapshot of the quality. So we are measuring user voice, we are measuring management oversight, we are measuring progress to outcomes, and I can scale them, 0 being rubbish, 10 being fantastic, and I get an instant graphical representation of the quality of services. And as you can see, the majority of my services come back for quality rating between 7 and 9, which I'm really happy about. If anything starts bubbling 2, 3, 4, 5, it immediately makes us start asking questions about what that is. And I can do that by team, look at variances, understand it. So we're measuring quality rather than performance. Practice model. This is our practice model in North Yorkshire. There are other practice models available. It's not about the practice model, it's about your own culture and context. So again, there are others here, including Lincolnshire, East Sussex with Stuart Gallimore, Hertfordshire with Jenny Coles. There are other practice models, but this one's ours. And what this isn't about vision. This isn't about strategy. We've got those. We have them coming out of our ears in local authorities. This is a private internal document for us as a children's service about what's really important to us all. From our staff at the front line to myself and my senior team sat around the table making decisions about where to invest money, what's important to us, what do we need to improve. At the heart of it is science of safety. For us, we use science of safety. If you see it as a process, you miss the point. It's a cultural change. It is strength-based. It is relationship-based practice. And it is about doing things with families and children, not to them. It's at the heart of our practice model about relationships, strength in relationships. Everything we do in North Yorkshire with our children and families is about creating lasting, changing relationships through relationship-based practice. So this practice model describes that. It's restorative. We do things with families. We use family group conferencing. We use systemic practice. This makes sense of our world in a way that a strategy and performance doesn't. And this is used daily. And it's one of the things when I go and speak with teams to say, practice model, are we comfy with it? What are we doing? What decisions do I take that impact you? What is it that makes life easier for you? You need to be clear about your practice model. I'll hand over to Debbie at this point.
Thank you. So the Association of Directors of Children's Services done a document called Signatures of Success. And again, there's a few things that I just want to pull out in terms of what they've said that makes outstanding children's services. So the first thing is it's everybody's business, that corporate responsibility. We all know that inadequacy is really expensive. The cost of services that are inadequate and the amount of money that you have to invest in your local authority if you get into trouble to get out of it is absolutely significant, and poor practice isn't good for children and young people neither. So therefore there has to be a corporate responsibility to make sure that your children's services thrive, because it's in everybody's interest that children's services thrive, because if it doesn't, it costs an absolute fortune to get out of the challenges that you're in. Just to reiterate the bit around stable workforce, absolutely, investing in a stable workforce is really important. It's your staff and their relationship with children, young people and families that make a difference. But there is a bit of a challenge here, because if a local authority does get into trouble, then the first thing that they do is go really hard on recruitment, and we get into a bargaining war and we steal from one another. And again, there must be a better way for the sector to respond, rather than us stealing staff from one another to make sure that our local authority area is okay at the expense of others, because that's not good for safeguarding children neither from a strategic perspective. So a number of regions are working really effectively in terms of memorandums of understanding, and certainly I think that that's something that we should collectively pursue. I spoke initially around having a vision and having a plan. So what we did is we set out pretty much what we wanted our outcomes to be for children and young people in Lincolnshire. We looked at the sort of rough numbers that we should have in terms of looked after children, and what percentage we wanted to stay within the family environment, what percentage we wanted to be with our own foster carers, and then what percentage we think should actually be in an independent provision. And then looked at having a robust plan, an investment plan as well, to actually realise that ambition. It is much cheaper if children are placed within a family or within your own foster carers than high-end, out-of-county, expensive placements. And it's better for children to be within a family placement, within a local area, within a foster carer, rather than an out-of-county. So that strategic planning aligned with financial planning is really important as well. Political focus, I can't underestimate the importance of your lead member and of your leader. There must be an appropriate amount of political challenge and support, and they should be balanced. Absolutely, your portfolio holder needs to know what the quality of your services is like and talk to people on the front line to actually understand that. In relation to sort of performance, challenge and culture, again, I suppose a few things that I just want to highlight there. The sector does a lot of peer reviews when you go into each other's local authority and come up with some recommendations. Listen to what people are saying. If people are saying that they're concerned around your services, they've given their time to go into your area, why would they not want to give you their honest appraisal? And it's around listening very firmly to what they're saying. Ofsted rarely get it wrong. We might argue on the margins of requires improvement, good or outstanding, but Ofsted very rarely get it wrong. And now with the focus visit, there's an opportunity to address the issues that they're highlighting before you get a full inspection. Be absolutely committed to learning and hearing what other people are saying. But one of the most important things, I think, as well, is listen to your partners. Your partners, particularly your health staff and your schools, will know if they're concerned around deteriorating performance. They'll be the first to tell you. So my advice is definitely to listen. Stuart spoke a lot around workforce, so, love your staff, monitor it, look at what your agency rates are. You want to seek low turnover of staff, low staff absence, making sure that they've got good management oversight and reflective supervision. So when we spoke to our staff, we said, why do you like working in Lincolnshire? And they like working in Lincolnshire because they've got manageable caseloads, they've got good management oversight, they get good professional development, and they feel supported. Money is a secondary issue. We don't pay the highest, but we do have a really good infrastructure to help them to thrive. And then just something around partnerships. So children's services can only thrive if you're supported by your partners. If your partners send everything into children's services will drown. Social workers will have caseloads of 40 or 50, and children won't be safe. Children can only be safe in an area if everybody does their bit, and that does require your partners to stand up in terms of early help arrangements. We're really fortunate. We've got really well embedded early help arrangements with about 75% of those young people supported by their school in terms of early help arrangements. So getting your schools on board is essential, because what that means is that very, very, very few people then need to darken the doors of social care because they're supported within universal services where the families feel much more comfortable talking around their challenges. So strong engagement and commitment from your partners, and very much a culture of openness. Talk to your partners and they'll tell you what's working well and what isn't working well. So just a sort of few final points for me before I hand back over to Stuart. So be wary of the determined DCS who wants to keep the chief exec out of their business. Stop them going down the rabbit hole. I think my leader will be thinking that I'm poacher come gamekeeper saying that since I've been doing the head of paid service role. Also, it never ceases to amaze me how complicated people want to make it. It's your DCS's job to keep it simple. And you need to keep it simple so that people can understand it. If it's really complicated, people won't know what they have to do. So simplify, 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 and then simplify it again. Listen to your partners, listen to your elected members and your parents. Triangulate with what you think you know to what they're saying. There will be something in it if they're not happy. And have that culture of high support, high challenge. But other people, when they come in, Ofsted or peer reviews are rarely wrong, so don't put your head in the sand and discredit them. There will be something in what they're saying.
So a final couple of slides, really. And so it's entitled Killer Indicators, because there's a lot of talk just around which Which indicators tell you that your children's service is in trouble? And the easy answer is there aren't any, but they're contextual and they should make you ask questions. So if you see caseloads high, if you see staff leaving, if you see numbers of child protection rising, if you see that you're no longer doing your assessments on time, all those things should make you ask deep questions about what's happening. What's happening to the flow? Why is that changing? And what is it about our system that's making those things happen? They're questions to make you dig deeper. On their own, they're not the answer. No one single killer indicator. Your best way to diagnose your service is going to talk to your frontline workers. It's as simple as that. They will tell you really openly and honestly, they're really good at it, about what's working well and what isn't. And you'll detect when they're being hesitant, and you can open them up around that. And that doesn't just need to be your DCS, that should be the elected member, and that should be your chief executive. So I'm quite happy when my chief executive turns up in one of my teams and asks questions. That's not a threat, that's not difficult, that's not why they're interfering, that's how it should be. Asking questions to triangulate and check and hold me accountable for the services that are provided in our area. So go and ask. That is what peer review is fundamentally, isn't it, when someone else comes in? There's nothing magic about it. They look at your data, look at your quality and go and talk to staff. You can do that yourself as well. Go and ask the questions of your frontline staff. Keep close to them. Just ask, probe and listen. Be part of peer reviews, as Debbie said. There are plenty of peer reviews available and happen now. Invite them in, be part of it and listen to what's said. Listen to what's coming back at you through that. Make more use of the growing regional improvement alliances. Through the Yorkshire and Humber, we have a strong regional alliance now where we have a lot of sector-led improvement, peer reviews, invites, challenge, annual challenges. Be part of that, be involved. That should also involve your chief executives and elected members at times through that process. And make sure you understand how that works regionally for you. So what we would recommend at the end of it is just a few simple things, really. As new chief executives and new lead members, there should really be a clear induction about the key issues and the signs of success and failure regarding children's services. See, no one wanted you to have the rest of them. It was that slide was so important. Just a quick look on out the back. Understand those basic conditions for success. Understand, use the Ofsted questions, visit teams and ask them. Ask them what it's like. Ask them about their caseloads. Ask them what gets in the way. Ask them about their support. Ask the key questions around those basic conditions. They will tell you. They will get used to that happening. And understand the quality of practice and user voice as well as performance. Triangulate, use all three things. And that should give you a fairly good insight into children's services. Thank you. I think we'll take some questions. Yeah.
We have time for some questions if you're I think it's clear from what Debbie and Stuart have said that actually just sharing information is really important, and I hope there's some good key pointers come out of there. And thank you for those of you on iConnect. I have some questions here, and I'll start with, given the overwhelming focus that our NHS system has on propping up its acute setting and coping with adult-driven demand, have you secured sustainable? How have you secured sustainable health buy-in to supporting the safeguarding and care of children, and to help you become outstanding? So if you want to say that.
I'll try and answer that one and then hand over to Stuart. I suppose the first thing to say is that if we think around what are the elements of health that are absolutely essential to support children and young people, particularly in the community rather than in the acute. So the role of the health visitor, the role of school nursing is absolutely critical. And they are commissioned by the local authority. So they are completely in your gift to secure really strong universal health services because you are the commissioner of them. We decided in Lincolnshire to insource school nursing and health visiting, and we've radically reviewed the model, particularly that of school nursing. And then we've implemented additional visits for health visiting. So very much in control of that universal health service. We've also, through a Section 75 negotiation, negotiated that we are the lead commissioner for child and adolescent mental health services, and over the time that we have been commissioning child and adolescent mental health services, they've actually secured an outstanding CQC judgment as well. And I think that is because that we've been able to integrate the services because we're the commissioner of those services. When we look to in-source school nursing and we radically reviewed the model, what we did is that we invested jointly with our schools. We put £1 million in, and our schools collectively put £1 million in as well, to create what we would call Healthy Minds. So it is a county-wide service that supports children who don't reach the threshold for child and adolescent mental health services. So it's a sort of well-being service. So actually we're very firmly, from a children's health perspective, in the driving seat and leading the vast majority of health arrangements, with the exception of the acute service.
Stuart,
so it's a really difficult one, this, with health, I think. So operationally, we have really good partnership arrangements with our health colleagues about delivering particularly safeguarding arrangements across the whole county. And we work really hard at keeping those safeguarding arrangements right through our new multi-agency arrangements and having clear sight and accountability and ownership through there. But more and more, it's getting a really difficult fragmented system with health to be able to do that. I was actually part of Lincolnshire doing that CAMS commission. Lincolnshire has one CAMS commissioner, one CAMS for the whole county. In North Yorkshire, I don't have that luxury. It's provided by different providers, commissioned by different CCGs, and it is far more complicated a landscape. I always think, and I've said this to Department for Education and others, that we as local authorities should be more involved in the commissioning of pathways for health that affect children, because we are one of the only agencies that just think about children all the time. That is our job. Day in, day out, we think about children, and health is often too consumed by the adult world. So I would like to see more joint involvement and joint commissioning of health services. The other way around that we've got that is we started employing and paying ourselves for health people. And it's that balance of, is it the right thing to do, but what's the right thing and outcome for our children? So I have quite a lot of clinical psychologists placed within our frontline social work teams. It's called Psychologically Informed Partnership Approach. They are worth their weight in gold, providing formulation and direct work with children. We as a local authority pay for that. We have speech and language and clinical psychology in our leaving care teams. I think National Health Service should be mandated to provide those services. They don't currently. We as a local authority pay for them. We have a internationally renowned now No Wrong Door programme, residential hubs, where we have integrated police, speech and language, and clinical psychology working with ourselves at social care. That means that I don't have to place children outside of the county, ever. We pay for those posts. Now, in some ways you could argue it's the wrong thing to do. On the other hand, that's giving our children the right services at the right time and providing the best outcomes for them. So I think it's a really complicated landscape, but I'd like us to be far more involved in the Commission of Health than we currently are.
Thank you. This one's for you, Stuart. Can you go into a little more detail on the plan which helped you to get to a zero agency worker in North Yorkshire, and what percentage agency staff were you at when you put the plan into place? When
the plan came into place, it was probably, it meandered up anywhere up to 7 or 8% of agency. And it was I have to say, I wasn't in North Yorkshire when this decision was made. I'm really clear about that. I'm not taking responsibility for something that I wasn't there for. But I recognise the philosophy of just saying no. We're not going to do this anymore. A really clear message. Now, as counties, we can use our geography really well. If you're a social worker in the heart of North Yorkshire, it's really difficult to go anywhere else. And if we've made a really clear strategic message of, we aren't going to have agency workers, so if you don't work for us here as a permanent member of staff, you won't be working for us. It's a really clear message. Now, get that right with the conditions of service that mean people want to stay with you, and it just very quickly went down. Now, sometimes that's difficult. We, like anywhere else, have teams that have more pressure at different times. We have parts of our East Coast that are hard to recruit to, and it can be difficult, but we hold the line on no agency. And we use our flexibility. Again, as being a larger county, we have more flexibility of how we can deploy staff. So we hold the line on it and refuse to use agency, and have managed now to do that for 5-6 years. So no agency staff, and it's worth its weight in gold.
Thank you. I'm sorry, we've got one more here, which is, what is the role of members of Children's Scrutiny in understanding and achieving good? So what's the scrutiny role for members?
Yeah, it's a really important role. I always make sure as DCS that I go to our scrutinies. I think it's a really important accountability role, and I want our scrutiny to look at the most difficult issues. So it's a constant communication with them around what items are they looking to scrutinise, how do I help that? I want them to be involved in it. It is absolutely part of the accountability and the to and fro. So it is an important feature that they understand that we direct them to the things we're most worried about. So our scrutiny have been looking at elective home education, they've been looking at inclusion, they've been looking at some really difficult issues. And it's right that we do that together so that we don't have any surprises. I want them focused on the most important things.
Probably just a couple of things that I'd add to that. I think when you get a new scrutiny committee, I think it is absolutely essential that you do some development with them so that they understand the complexity of children's services, particularly around the performance. And then the other thing that our scrutiny have done is go out and talk to frontline staff. Again, can't underestimate the value of going out and getting people to talk to frontline staff around their experiences.
Thank you. I guess someone will tell me when I've got to stop. I've got a couple more questions here. This one's for Debbie, and it's, how did you get your schools to input £1 million considering the academy status, etc.? Culture's really important, isn't it? It's the context within which we're working. So we have got what we call a Lincolnshire Learning Partnership. That is where we bring our schools together, where we sort of like strategically hold the ring to actually engage with our schools. All of our schools are part of that, and all the schools want to be part of the family in Lincolnshire. We have worked hard to make sure that our schools forum is represented across all of the various different types of schools that we've got, but also that they understand the complexity of children's services and the need to actually make sure that everybody needs to contribute, and it needs to be everybody's business to make Lincolnshire a safer place. They were really frustrated around a lack of what they seen as support through CAMS, Child and Adolescent Mental Health Services, but actually through dialogue with them, they did understand that actually their threshold is around mental well-being, and they wanted to make referrals around emotional well-being. And the only way that they were going to address that in terms of a service area is if we both financially contributed to that. We've got a pathway in terms of when it's appropriate to make a referral, so that one school isn't putting a disproportionate amount of pressure and an ask of a service area, so that they recognise they all get their fair share of support through that service. But I think it's the context and the culture of the relationship with schools that gets schools to a place rather than just a single individual decision. Thank you. I'll take this as a final question. Has your recruiting process for social services changed in the last few years? If so, what are the key changes? I'll
respond to that and then get Stuart to say something. So we have done a lot of work in terms of recruitment. So we've significantly reduced our agency rates and significantly reduced our vacancy rates as well. So we've done a number of things. We've done a recruitment activity to actually talk to our staff to say, why do you want to work in Lincolnshire? And we use that as a recruitment strategy. So we have an all-on recruitment. We're always recruiting. We don't have a particular time. If people apply, then obviously we will interview them at any point in time. A sort of clear branding, a good workforce development offer. I have to say the Partners in Practice programme, so we've supported through the Partners in Practice programme Rotherham, Tower Hamlets and now Northamptonshire, and that is an absolutely fantastic opportunity for our staff. They get to go into another local authority, it helps them learn, it gives us an opportunity to do much more career development. So there's a whole range of strategies that we've done to try and support recruitment.
Yeah, I'd agree with most of that. And what we do now is much more sophisticated in our recruitment. So it's important that you benchmark your competitors around you as well. And that's not to have a price war, but salary is important in some respects to social workers. So keep in touch with where everyone is. You soon find gaps if you don't have your progression grades to move into. So look what your neighbours are doing, keep in touch with that, but make your recruitment easy so that they can join you really simply if that's what they want to do. But keep in touch. If you get the conditions right and you get that working, it's a self-fulfilling prophecy as well. When it's great, it's great. You soon find if people start leaving, start asking the question, why is that? Why have I suddenly got people leaving from this area? It's one of the things that catches you out quickly.
Thank you. The question we were asked first was, what does good look like? And I think Debbie and Stuart's insight this morning has really given us a clue as to what is achievable and how we can achieve it. And I'd like to thank Debbie and Stuart for this morning. Thank you very much.